Good afternoon, and it's nice to see all of you at this event. So my name is Tsitsi Masvawure. I teach in the Health Studies program. I coordinate and advise our majors as well, and the Health Studies with the McFarland Center, and the following departments are sort of co-sponsoring this event. So in alphabetical order, we have Anthropology, represented by Professor Susan Rodgers, who's going to be one of the faculty panelists. Biology, we have Professor Sheehy. She's just made it. She's coming from another meeting. Political Science and International Studies, we have Professor Judith Chubb. And then Religious Studies, we have Professor Mary Roche. I'd like to start us off with this quote from one of Paul Farmer's writings. Young men, are you not capable of complexity? Paul Farmer made this self-deprecating statement in one of his books as he reflected on his early days in Haiti, when an old Haitian woman chastised him for failing to understand how voodoo beliefs could coexist alongside Western biomedical beliefs. As the old woman explained to him, and I'm paraphrasing here, if you want to treat illnesses that are caused by human hands, i.e. witchcraft for us anthropologists, you have to go to the voodoo priest. If you want to treat illnesses that are from God, natural causes, then you go to the hospital. Farmer reflected this complexity in his work at Partners in Health and also through his writings. And more importantly, perhaps for me, is he considered the poor, and these were the communities that he worked with, poor people, marginalized people, but he considered the poor to be knowledgeable, and he took it upon himself to learn from them. So as you all probably know by now, Paul Farmer died suddenly in his sleep last month at the age of 62, and I realized I was psychoanalyzing myself, and I figured the last I heard was he died in his sleep. And I don't know exactly what happened. I'm sure it's up online, and I feel I've just been resisting finding the actual cause of death. So I still don't know what the exact cause of death was, but maybe some of the panelists do. And so a few faculty, as Tom said, decided, we realized a lot of us use his works and his ideas in our courses from all of these departments. And then we're like, let's do an event and sort of commemorate the work that is done and sort of reflect on what we've learned from him. So thank you for being here today. The event will start with part of the documentary called Bending the Arc. It's a long documentary. We'll only do the first 25 minutes that cover his time in Haiti, because this is where he started doing his global health work. And Partners in Health was formed through that work in Haiti. And then this will be followed by an open discussion with all of us that will be moderated by Tom Landy. And then we will wrap it up with the faculty, the different faculty panelists reflecting on how they've used his work in their different courses and sort of how we intersect with Paul Farmer in our courses. And then we'll also invite another interactive discussion based off the conversation from the faculty. We envision that the event will take maybe an hour, 50 minutes. So thank you for spending this afternoon with us. And we'll transition to the documentary.
Thanks, everyone. I'll invite our panelists to be up here just in case there are questions and introduce you again there. But we're also going to take a moment to, before we hear from some of the panelists about that, to want to hear from you about Paul Farmer, about what's impressed you, about what you knew about him, or maybe what's new to you. I'll say, you guys can come on up, and I'll say for my own part, and it was, there's the notion of accompaniment there, and I think for me, often earlier, the profound sense that people who were fatally deemed to be incapable of being cared for really fully, for Farmer, what it really impressed me always early on was that he recognized and made people agents in their own care, that there was a sense that people on really difficult issues like tuberculosis, like AIDS early on, that they could participate in their own care and be part of that. And I think he showed what was sort of taken for granted as not possible to be more than possible, and I find that really particularly helpful. From the audience, I know we have a microphone because now we're being recorded, so we can put this online, but if somebody be bold and step up, something you have a question about Farmer, or about something you saw in the film, or anything you know about him that you've been impressed by. Some of you may have read Mountains Beyond Mountains, or know him from those sources. Anybody want to say anything? We didn't want to make it a sort of we talk at you and you listen event, so we're putting you up there up front right away if you want to do that. So while they're thinking then, because I know they're thinking deeply, I'll introduce the faculty again, and we have at the end Professor Mary Doyle Roche from Religious Studies, Tsitsi Masvawure from Health Studies, Professor Tsitsi Masvawure, Professor Susan Rodgers, Professor Emerita of Anthropology, Professor Ann Sheehy from Biology, and Professor Judy Chubb, Distinguished Professor of Ethics and Society from Political Science. So who will I ask? Susan, I'm going to ask you to say something first. How about that?
Okay, one thing that I was surprised about, may I take my mask off just to talk?
You may.
Does that bother you? If it doesn't?
If it's okay with them, it's
Is it
okay with
okay?
me.
Yep, okay. One thing that surprised me about this film, which I had never seen before, was that Farmer emerges as a physician from Harvard. He emerges as a social activist who founded manifestly wonderful clinics, but he doesn't emerge as an anthropologist. And I think his medical anthropology identity is absolutely central to his success. That is, he did years of field work in this deeply impoverished village area of Haiti and found out how the local people were imagining infection with HIV, which in many cases progressed or regressed to AIDS. And he was able to put susceptibility to HIV, vulnerability to HIV, into a holistic context in relation to economic processes that were going on through globalization, in relation to bad leadership at the highest level in Haiti, in relation to Haiti-U.S. relationships, in relation to racism, anti-Black racism in the U.S. He put everything into a broader context, and that's the essence of anthropology. And I wish that the filmmakers had remembered that he was an excellent anthropologist, which is actually the reason why I let his work take over my courses. In my last 2 years of teaching, I was here, I was able to teach Anthro 101 again, and I totally threw out the old syllabus and made it a Paul Farmer / Nancy Shepherd Hughes, another medical anthropologist, in her case from Berkeley, course. And it inspired the students, I think, and it probably was the best version of Anthro 101 I'd ever taught. So there's a really strong anthropology component to his work.
Thanks. Nobody's jumped up yet, so Mary, I'll ask you.
Sure, sure. Well, I have to laugh because I think theologians also claim Paul Farmer. You know, I should say I teach medical ethics here. I see a few folks, and I teach a seminar on HIV and ethics, and so Paul Farmer's been really instrumental in that. A couple of reasons. I think one, not a trained, perhaps, theologian, but clearly somebody who is an avid reader and someone who sort of is a voracious learner. I don't think people appreciate the way in which his work was impacted by liberation theology, particularly as it emerged in Latin America. He actually worked with and wrote with Gustavo Gutierrez, who, if anybody here has been in, certainly in class with Professor Eggemeyer, you will know that name, the sort of leading figure of Latin American liberation theology, and they work together. The reason I think that I find using his work so compelling in class is that he uses language like the preferential option for the poor. He uses it very well, right? But also uses it in a way that can communicate with people who are not necessarily thinking theologically and certainly not thinking within the context of Catholic moral theology. So he's really able to translate that. I think the other thing for me is, and I appreciate seeing this piece of the film where he's really quite honest about having really good intentions, but not knowing a whole lot. The more he learned, the better he got. But that by the end, after his sort of most recent book, theologians were writing about him as an expert in mercy. Somebody who had the right intentions, the right motivations, and they could match that with the kinds of experiences and practical knowledge that people needed. That's what Jim Kim, I think, was talking about when he, in that conversation with his dad. What do you bring, right, to that conversation? And when I want students to see what the preferential option for the poor looks like, it looks like Paul Farmer to me. And also I want to just highlight, because he works with the people of Haiti, and I think there's a way of looking at this, particularly striking in the film, that makes him sort of appear as a white savior, kind of moving into that environment. And I think that that's sort of the wrong way to look at the work that he's doing. But to see sort of what that looks like, and what a life well lived can look like. And it doesn't have to be this. I think the other thing for Mountains Beyond Mountains, and Jim Kim saying, you don't mimic him. You don't mimic him, right? You're inspired by him to be the person for people in the world that you are called to be, with all of the sort of expert mercy that you can bring to that. So that's my piece.
And of course, we're focusing on him here in Haiti, but we can add Peru, Rwanda, we can add a real movement that's spread out in the world.
Absolutely, absolutely.
We had time to look at that. Thank you. I was struck too in the film, of course, we start out with the condemnation of the World Bank, and then we see Jim Kim, who becomes president of the World Bank. And there are ways that he manages to square a lot of those things, I think, to move, he and the people around him. And it's in fact a story, as you say, of him motivating and mobilizing a whole group of people. So it isn't simply a Paul Farmer story, and he didn't want it to be just a Paul Farmer story. And I think that's really important.
Yeah.
Keep in touch.
Can I follow up on that?
Please.
I apologize that my voice is not in very good shape. I just wanted to follow up on the point that Mary was making about not looking at this as the white hero who comes in and saves the poor people of color. Because what the film doesn't show, or at least it doesn't show because we don't get to the end, is that his vision was not to build an American or Western hospital. It was a Western hospital in the sense of the technology. But he always worked with the governments of the countries that he was in to plan a larger health delivery system. So he starts off with a clinic, but then he ends up with a large teaching hospital, a university in Rwanda, which is where he died. But I think the emphasis on working not just with the poor, but working with the institutions of the countries themselves in order to get away from all of those criticisms of the World Bank, of Western NGOs who come in and parachute solutions in from the outside, rather than working, again, not just with the people, but with the political system of the country itself. And then, could I just borrow your copy? I just want to say a few words about the political science dimension of this. Since I'm not an anthropologist, I'm not a public health specialist. What I find most compelling about Paul Farmer, from a teaching perspective, again, following up on what Susan was saying, is how he examines health inequalities through the lens of unequal relationships of power. So if you look at this book, which is the one I always fall back on, it's called Pathologies of Power. This is not the way people usually think about healthcare inequality. That the problem is ultimately power and its unequal relationships of power. So in a couple of my political science classes, and some of you are here who know this, I start with the concept of structural violence, because what I find most compelling about Paul Farmer from a teaching perspective is this idea of structural violence, that unequal access to economic, social, political power predisposes certain populations, distinguished by class, race, gender, to unequal health incomes. So you can see this in the plight of the Haitian peasants in the film, but you can take it to the impact of Hurricane Katrina in New Orleans in 2005. You can take it into Roxbury in Boston and look at the differential impact of the COVID pandemic by class and by race. That's a Paul Farmer way of looking at the world, that you look at the underlying structural inequalities that predispose certain groups of people to negative health outcomes. So, as a political science professor, we usually focus on direct physical violence, war, brutal dictators, police states. But I think it's really important for students to understand that the greatest source of premature suffering and death in the world is not wars and dictators, it's structural violence by many, many times over. And if we want to deal with these problems, we have to first off deal with those underlying structural inequalities and work for his vision of trying to make high-quality health care a basic human right.
Thanks. I'm struck about Farmer that he was someone who paid attention to those structures, who also found himself at places, he was at the Brigham and Women's Hospital. He stayed there as a key person. He was also embedded in the communities that he did. He didn't let go of all those big structural questions, yet he managed to be with people, and it's more than I think a lot of us can do, but it's so much, I think, the right answer to try and square those together, because the temptation to just go off and save people, as Mary said, is nice, but it may not get us very far. Tsitsi, we're in your realm of expertise, so
I'll take off my mask. I think I want to start with sort of how I met Paul Farmer in academia. And so imagine me in Harare, which is in Zimbabwe, Southern Africa, and I get access to AIDS and Accusation, which is his book, one of his major first books, where he talks about the HIV pandemic. And at that point in my life, I'm running an HIV prevention organization on a college campus in Zimbabwe. And he's talking about, the structural factors, gender, inequality, and how that fuels. And I was sort of in that space where I'm trying to do grants to get money for a gender and HIV prevention program. And this is early 2000s. And funding organizations are just like, well, gender is too complicated. Let's just do the prevention education, right? Teach them about condoms, et cetera, and really struggling to say, but this structural support, these gender norms are a big part of the story. And so reading Paul Farmer, in my backyard in Zimbabwe and just having this aha moment, I was like, is this guy an academic? Because then he also writes with so much passion, and sort of seeing the possibilities that you can be a serious intellectual, but also an activist, like somebody managing a program, and these two things don't have to be in conflict with each other. And then I was just like smitten and just devoured infections, inequalities, and just the titles tell you everything. And so I'm happy to be among colleagues who have taken Paul Farmer and used them in their courses. I designed an entire Montserrat seminar, and it was called Pathologies and Power, and we spent the first semester looking at pathologies, right? Social inequalities, economic deprivation as pathologies, and then power sort of, right, the institutions, and then from the ground up, how are communities responding to these pathologies? So this is sort of my take to him, and thinking about, people-centered healthcare, right? Where you listen to the community, so medical pluralism, where it's like, yeah, they believe in voodoo because it's playing a very specific role, because they imagine health broadly and illness and disease as entangled within your social economic realities, right? So it's not just like this biomedical, right, this biological entity. And just seeing that in somebody like Paul Farmer, who is a serious academic, a serious medical doctor, and arguably a serious anthropologist as well, bringing all of this together to tell these really compelling stories about how things can be done. And my absolute favorite, I've lots of absolute favorite Paul Farmers, but one that I've been using a lot in class is called Landmine Boy and Stupid Deaths. And so he starts off in Rwanda. These boys have, two boys have picked up a landmine, it's exploded, they're injured, and he sort of peels the onion, so to speak, like peels it backwards to say, okay, I can treat these kids, give them access, all of that stuff, healthcare access, but then he says, but hang on, right, who makes a landmine that looks like a child's toy so that kids can pick it up and be injured? And it's like, we need to have a conversation that takes it all the way to who is complicit in these kids getting injured. And I sort of like taking it that far back, because then it sort of brings all these powers, these powerful institutions. It brings the US, it brings, Germany, whoever is making these bombs, to look like toys so that they can cause massive destruction. And it's like, we can do global health at this level. Let's have these conversations. Who's making this dangerous equipment? And start there. And maybe the global health is not happening in a clinic. It's happening, at NATO or, whatever the power centers are, it's happening at the World Bank, happening at IMF. And so I really like that part, because he really goes over and beyond what most people would do. Like, who's making the bombs? Let's talk to those people and solve the global health problem from that perspective as well. So I'm a Paul Farmer enthusiast, so yeah.
I like your notion that the way he complexifies situations somehow works, because I think oftentimes with an NGO, you'd say, can't take everything on, sort of let's do this or whatever. And maybe some of we academics can be confused of over-complexifying in ways, but there seems to be a way that he actually complexifies in a fashion that helps us see the big picture rather than obscure it in complexity. So,
Well, he tells a story about it, and that's what draws you in, yeah.
so narrative, power of narrative, we could add to our. Anne, any thoughts?
So I think I feel like I'm a little bit like, which of these people does not belong?
Come
I'm a scientist. No, I think Paul Farmer would say, what are you kidding me? So I'll tell you a little bit about where I first encountered Paul Farmer. So I studied science. I am not an anthropologist. I am not a social scientist. But I started studying science right as the HIV pandemic was bursting over the world. And I had every intention and did follow through working on HIV at the scientific level. But what started sort of bothering me was that science is supposed to be objective, or that's what you're told. And so the conflict that I ran into is that in the early days of HIV in the United States, there started to emerge this concept of what I would call disposable populations. So the people that were disposable were for those of you who are old enough to remember, were the 4 H's. The heroin users, the homosexuals, the hemophiliacs, and Haitians. And so this is where I ran into Paul Farmer, because he was being involved in Haiti at the same time with tuberculosis and HIV. And this concept of we were willing to let these people die, or, as happened with a lot of homosexual people in the United States, homosexual men in the United States, we maybe wouldn't let them die, but they had to advocate for their own health, even though they were dying in droves. It was their responsibility. And it was Haitians' responsibility to save Haiti. And it was the heroin users' responsibility to get clean before we would help them. And hemophiliacs we were really sorry about, but there wasn't much we could do. And so
those 4 because of vulnerability to HIV.
Yeah.
At the time, it was associated with those 4 groups.
With those 4 groups. And of course, that's not where it stayed. And I started, and so then, and Tony Fauci was in the mix, and Paul Farmer actually met Tony Fauci during this time. And they developed a lasting relationship that was very influential. In fact, I'm pretty sure Tony spoke at the, he eulogized, yeah. So he spoke at Paul Farmer's eulogy, did a eulogy for him. And so what this kind of needle in the, like, kept niggling me in the back of my mind as I was getting my degree and everything is, people would say, that's not your job. That's not your job to advocate. It's your job to be at the bench, and it's your job. But the issue was that once you become a PhD, you have authority and you have power and you have privilege and you have a voice that people are willing to listen to. And there weren't people using it. And so I went, I've seen Paul Farmer speak a bunch of times. Anytime he was within about a 100-mile radius, I would make my way there. And he was just so inspiring. And I think the thing that struck me the most from the documentary that I'd forgotten is so striking. Because coming from HIV is his willingness to be with people. Like people are hugging him and kissing him, and they are ravaged by disease that is infectious, right? So it's an infectious disease, and he just walks with them. And to me, that was who I wanted to be, and then sort of was like, then came to the realization that's not really who I want to be, but I want him to inspire me to be the best that I can be with the voice that I have and the tools that I have. So in many of my courses, I don't assign explicit long readings from Paul Farmer, but I infuse it in the sense. So a non-majors course, I spend a great deal more time with Paul Farmer and some of the work that he's influenced. But in some of my majors courses in the department, I think about, when I talk about measles as a virus, tens of thousands, hundreds of thousands of children die of measles. And then the students are often like, well, I don't understand that because I don't see anybody. And we think about where in the world are these hundreds of thousands of children dying of a disease that's preventable that you have never even seen. And we do that with, a number of diseases. So, and I've lent this book out. This is probably my third or fourth copy. Everyone I lend it to keeps it. So all the students will come by and take it out of my lending library, and then it's gone because it is so inspiring. But that's how I've used Paul Farmer in my own work, and I brought this because it is a touchstone, and it makes me think about all the wonderful things that I have been able to accomplish because. To him, nothing seemed impossible. You're just like, okay, well, I guess I'm going to do this. And so sometimes when things seem really hard, it's nice to remember that there are other people who think everything is possible. You just have to figure out who can be your ally, who do you know, who knows who you know, and these complex things feel a lot less complex.
He very much was a hopeful sort of person, I think, and that's rare in the social sciences. I think, Anne-Marie, anthropologists tend to be rather cynical people often and without hope. But another thing about Farmer is that he's readily translatable to other parts of the world. For instance, you might think if you've only recently encountered Farmer's work that it relates to Haiti, to rural Haiti, and to Rwanda. Well, that's not true. I spent all of last academic year working with Surbi Dayani, who is an honors student in anthropology here at Holy Cross, and we did a joint project inspired by Farmer's understanding of poverty as structural violence with the Burmese refugees who live literally right down our hill in South Worcester, and many of them have disease conditions that persist over years, and yet here we are in central Massachusetts with some of the world's greatest biomedical care. The refugees from Burma have green cards, they're fully documented, fully legal, and they have mass health, no matter what their income is. That is, they're fully insured, and yet they have persistent lung problems that go from year to year to year. And I know in the case of one person who I'll call Bomei, who I've worked with for 10 years, from Karen Society in Burma, a refugee, now a U.S. citizen. She suffers from these continual pulmonary problems, not from asthma, not from tuberculosis. I've talked to her pulmonologist, it's not that. It's bad housing conditions. There's mold inside the house, and the damn landlord refuses to fix it. even though her pulmonologist put in a word to the city housing inspector to get a housing inspector out there. And they did, and finally that nudged the landlord to fix up part of the house. Well, it's a structural problem of bad housing. The woman's husband is in a manual labor job that's absolutely exhausting. He doesn't speak very much English at all. So that means he's stuck in his manual labor job. That's the only income earner in this household of 6 people. And they can't move to better housing because they can only pay $1,200 in housing costs a month. And I, being kind of a newly refashioned activist anthropologist, went to the pastor of this woman's church, which happens to be my church, the First Baptist Church on Park Ave, and asked if there was any way that the church could raise some money to kind of subtly supplement the household's income level so they can get into better housing. And the pastor was very sympathetic, but the family refused it because they want to wait several years until their oldest children graduate from Worcester State, and they'll have full-time jobs. But the family is stuck in place, basically, and Paul Farmer would understand that like very few doctors at UMass do understand that.
So you raise one issue that, you know, there's a charity ideal here, and there's a structural ideal here, and usually they're kind of separated, but your example kind of brings them together. What about with Farmer? Do you see that healthily complexifies the binary that we often have between
Yeah.
charity and structures? And I like your point that he's hopeful about structures, because usually when we social scientists talk about structures, they always seem to be bad things in every way possible. So I think that the interesting thing is he or Kim or whatever went about working to change those and giving us.
And I think that, you know, the quote that you opened us with, right, are you not capable of complexity, right, which was holding together a lot of different elements of people's experience. And I think this, again, is another area where he grows in an ability to do that. So, and I think because clearly he is encouraging people who can be charitable to be charitable as they possibly can be, right? And calling on the hospital to donate the medication, yes. But before long, they are also bringing children from Haiti here right, to have certain kinds of procedures that are only available here for other problematic reasons, right? But works on the charity, and then there are sort of systematic changes and commitments. But I think the other piece of this, and it's related to that element of hope, right? Which you don't necessarily maybe get from a title like Pathologies of Power, right? Pathologies of Power. What I think is absolutely brilliant is the course title, if you were listening really carefully, is Pathologies and Power. And I just finished reading Alicia Garza's The Purpose of Power, so that's the Black Lives Matter movement founder. And so there's also this right complexity that social justice piece, but it's also really about knowing how power works and what it's for, right? And it's for the common good. It's for making sure that the most vulnerable people get to participate in that good. And so, so even though power does seem sinister, right? He doesn't fall for that as much as sort of the kind of rhetoric is, but he learned how to leverage it, and he learned how to have people come around to his way of thinking about what they could do with their wealth or their influence, and when those things come together. But also the kind of power that people who had very little material goods and very little political power, right? And that didn't make them powerless, right? And so to kind of really build on
He
that
raised
was
up
really
their
remarkable.
agency to help solve their own problems in a way, so it wasn't just
Right.
we're gonna help these people who can't do
Right.
anything for themselves. I like that.
My suspicion is he probably also used his own charisma and crafted his identity as almost a savior-like figure strategically, so that he could raise the public awareness of structural violence and get people from medical schools to public health outfits to the newspapers talking about health as a part of a larger system of very often, tragically enough, structural violence. So I think, he didn't kind of accidentally become such a hero figure here. I think he had some agency in creating that, and we might critique him for it, but I suspect it was for good strategic reasons.
Now you're back to being a social scientist.
I
You
always
critique him
am.
for that, so. Anything we can say about, we saw early Paul Farmer, so is this just a story where he figured it out by the end of the 90s and it just sort of reverberated, or do people know, are there ways that continued to grow, or how he continued to learn? Anybody? Tsitsi, maybe?
I think one thing that comes up in his work in Peru, right, we sort of see Jim Kim take the lead, because initially he was like, TB has been figured out in Peru, we can't divert resources, and then realizes the way they were doing it, right, was problematic, again, because of these institutions that said, this is how you treat TB, only this way, right? And then he realizes, no, we have multi-drug resistant TB. And so he learns to listen to others. And so when he goes there in person, sees like, oh my gosh, this is a crisis, then he sort of allows Jim Kim to take the lead and run that show. And the work of the community health workers is a key thing. I think he was willing to learn and say, I was wrong on this issue, and I will listen to the people that I work with, and also learn from the communities that I've embedded myself in. And so his work in Peru is really interesting, sort of the dynamic in terms of how he starts to interact with these powerful institutions, which is why Jim Kim goes to the World Bank. But initially it's just like, oh my gosh, are you selling out to these same places? But then learns to sort of give people their space, to say, okay, this is Jim Kim's contribution to the organization, and I can learn from that, which I think is super important. And then I think just like his bodily comportment, just in the video, right? Like sitting next to patients, like we talk about bedside manner for doctors, right? There's something authentic and genuine about how he's interacting with people. He's very touchy, but in a very respectful, like, I see your humanity. That's sort of the vibe I get from him. And I think if you approach the world that way, you learn more from people, and you don't just see them as powerless, right? In some instances, they are powerless because, look at their living conditions, look at how they've been let down by the system. So what else would you expect, right? We can't expect people to come to the hospital if they have to walk 10 miles and they don't even have drinking water. So I think this ability to learn from the people you are helping and see them as legitimate sources of information, valuable information that you can learn from, rather than you're the Harvard MD telling them what to do, but to say, I'm actually learning a lot from the people that I'm working with. I think that moves along. And towards the end, we sort of see, of the documentary, we see his work in Rwanda and how he's able to infuse sort of this enthusiasm. Like he finds people who have the same level of enthusiasm without being him, right? So the former minister of health in Rwanda just takes it up and runs with it, and is almost like standing back and letting her get on with the show, etc. So I think the ability to learn from people that, in terms of socioeconomic status and how we define people, might be defined as less than you, but recognizing that I can learn from every person, no matter who they are, makes him, I think, helps contribute to who he is. And then there's a whole thing in Mountain Beyond Mountains about his childhood and his father, right? When his father takes him to, I think it's when his father takes him to work on a farm, that's where he sort of first meets Haitians, etc. And then he's like, oh, this is beneath me, I can't be doing this work. And his dad sort of like matches him off. He's like, I will show you what you're, what you're worth, like you will help out. And I think his upbringing sort of fostered that in him again, to say, no one is above you, no one is beneath you, you are together with other people as well. So the book is amazing. The documentary also tells a more complex story towards the end.
I
And
think Tom
the
in answer-
documentary is available online. You can watch that by Bending the Arc. You can just find. So.
In answer to your question, I think in some ways he became more radical in the last 10 years, because in one of the obituaries, it quoted him as saying that the kind of high-quality biomedicine that we, those of us who are well-insured, enjoy here in central Massachusetts, like my shoulder replacement surgery of last December, for instance, he said should be available to everyone worldwide. I mean, he really says it's not just that good clinics should be available in rural Haiti. He's actually saying that the kind of really high-level shoulder surgery I got from a torn rotator cuff should be available not just to me, this fairly well-off retired college professor, but it should be available to everybody. And that's really powerful. I'm not hopeful enough to think it'll ever happen, but he was pushing systems of power to at least, I have that as a possibility.
So I know you've all been thinking of questions or comments now, right? I'm holding back the responses. Anyone have any thoughts or questions or concerns? Please. Could you speak into the mic just so on the recording people can hear it?
Yeah, so I actually have a question that's probably geared more towards political science, and something that I did not consider before now was, I guess, the amount of financial resources that these intergovernmental organizations like the World Bank do possess that could really help people like Paul Farmer and others. But I guess it also strikes me that the way in which these organizations are funded, namely from wealthy Western countries, might incentivize them to serve the needs of those same wealthy Western countries. So is this sort of incentive structure fundamentally flawed, or are there ways that we can reform these organizations so that they're incentivized to maybe do more good for other countries as well?
Judy, can I give that to you?
That's a really big question. I think in the first place, you have to understand that Western countries only devote a fairly small amount of their budgets to any kind of foreign aid. And in the case of the World Bank, you can clearly see a shift in their policy, which occurred when Jim Kim was the head of the World Bank. And I don't remember exactly how that came about, because the previous leadership of the World Bank was in a completely different direction. But I think clearly, as citizens, we have a voice in terms of trying to put certain kinds of issues on the policy agenda which aren't there. And increasingly, the United States, I would say, has become more isolationist, less inclined to give money to developing countries. So if you look at Partners in Health, for example, and you saw this briefly in the film, initially they were funded almost entirely by this Boston billionaire. And they would never have gotten off the ground without that charitable donation. But what I think is really interesting in terms of thinking of long-term sustainable programs is that, once they get off the ground, then they have more leverage to ask for money, but it's not going to be a lot. But I think the partnership with local governments has been really important, because instead of just saying, which many aid organizations do, governments in developing countries are completely inept, they're a black hole, we're throwing money away if we give money to these governments. Paul Farmer doesn't want Partners in Health, again, to be an American organization cut off from the rest of society. So again, I think it's interesting, not just the personal connections to the poor, but to the elites of those countries, where he has gotten buy-in from the governments of those countries themselves to support that. So the expansion of Partners in Health in many of these countries has come through that partnership. And so they've made they've made Partners in Health sustainable because they train local people. And they don't want this to be a Western hospital staffed by Western doctors and nurses. But a huge part of their mission is that we want to build a sustainable health infrastructure here. We want to train doctors, nurses, technicians, and we want to do this in partnership with the government itself. Because I think if you rely on donations, certainly from the United States, they're very minimal. They're somewhat more generous from some European countries. But I certainly don't see the political will in the United States to donate large amounts of money to these kinds of causes.
Thank you.
Thanks. Other thoughts, questions? Or do you want to wrap up? Any wrap-up thoughts from? Usually if I say, do you want to wrap up, somebody runs up to the microphone. People will wait till the last chance possible. But.
Read the books, watch the film. Mountains Beyond Mountains, I always say is something written about Paul Farmer. It's quite captivating, but read what he writes, and I think that will pay off for you. Yeah.
So you'd start with Mountains Beyond Mountains? You'd start with Mythologies of Power? Or how would we?
I actually
depending
think
on the
Mountains
class.
Beyond Mountains because it gives you the overview and then you can read it.
Right.
And if you're going on to medical school, be a bit skeptical about that medical school traditional curriculum, because as many of us know, medical schools tend not to even have very many lessons on the importance of nutrition to health, much less the politics and power of different types of country and how that affects vulnerability to illness. So if you're in medical school, push for an expanded curriculum that can go beyond the bacterium that causes tuberculosis to these larger social, structural, political forces.
I was going to leave aside that Paul Farmer apparently wasn't the best medical school student in terms of being in class all the time. He might be in another country when he was supposed to be in medical school classes. So I don't want to hold that up necessarily as an ideal, but it was his way of breaking open and expanding his medical school education. I think there are very few of us who could probably skip a lot of Harvard Medical School in another country and do well on the exams.
But that's why his death at age 62 is so sad, because if he had had 20 extra years, he could have done so much with medical school curricula, for instance, from his position at Harvard and at the teaching hospitals in Boston. So it's a real loss.
And in
Rwanda,
founding a hospital, right, or a medical school is really.
No, it's really,
is
that's why
really
we were
key.
so devastated by his death. Just really a premature death at 62.
I just make one final comment. If you remember, at the beginning of the film, they're standing there on the plateau in Conge in Haiti, and it's a wasteland. That's where eventually they built this huge medical complex, delivering cancer care, all of these things that never existed. But I listened to the memorial service that took place last weekend, and every person who spoke said the key thing about Paul Farmer is he always said, you can achieve the impossible. So he looked at that wasteland and he envisioned this amazing medical complex, which didn't exist anywhere in Haiti, not even in the capital. And people said, that's impossible. He did it.
Yeah.
That's a great place to end. Thank you.
Yes.
And thank you to each of you for proposing this, for wanting to do this, and to raise up all the remarkable ways in different disciplines that he has influenced what you do. So, and thank you all for being here this afternoon.